You know that feeling, right? That little notification from your doctor's office pops up, and suddenly you're looking at this wall of text about your own body, and it feels like it's written in another language. Well, today, we're going to translate it. We're going to help you find the real story inside those lab results.
Yep, there it is. Your lab results are in. So you click on it, you log in, and bam. You're just staring at this grid of letters and numbers with these little flags that say high or low, and your first thought is probably, what does any of this even mean? It's totally normal to feel a bit lost.
And hey, if you feel a little jolt of anxiety when you see that, you are absolutely not alone. Of course you're going to feel worried when you see a number that's outside the normal range before you've even talked to your doctor. And that's the key word right there, interpretation.
So let's do this. Let's turn that anxiety into actual understanding. We're going to focus on decoding the two most common blood tests you're ever going to see, the complete blood count, or CBC, and the comprehensive metabolic panel, the CMP.
Okay, the easiest way to think about these is like this. The CBC, that's all about the cells floating around in your blood. You know, your body's little defenders and delivery trucks. The CMP, on the other hand, is all about the chemistry, the chemicals that tell us how your big systems, like your liver and kidneys, are doing their jobs. Two totally different stories, both coming from the same place.
All right, here's a little inside baseball for you. When a doctor or nurse looks at a CBC, they don't just read it from top to bottom like a book. No way. They have a system, and it all comes down to three key things they look at first. And this right here, this is the secret. They're not giving every single number on that page the same amount of attention. They're looking for the big headline first. Everything else, that's just the fine print. And once you understand what they prioritize, a lot of that worry just kind of melts away.
And here they are. They're called the 3 pillars. These are the first-glance numbers a doctor checks to answer the really big questions like, is there an infection going on? Is there a problem carrying oxygen? Is there any risk of bleeding? Seriously, almost everything else on that report is there to explain why one of these 3 pillars might be off.
So let's make this super simple. White blood cells, they're your infection-fighting army. Hemoglobin and hematocrit, that's all about how well your blood is delivering oxygen. And platelets, they're the crew that shows up to stop you from bleeding. If these 3 look okay, chances are things are generally in a pretty good spot.
Now let's take that same smart approach and apply it to the CMP. Instead of getting bogged down in a list of 14 different chemicals with long names, we can just group them together. It gives us a much clearer picture of what's going on.
See, the trick is to just group them up. Instead of trying to memorize what 14 different values mean, you just see them as different chapters in a story. This group of tests tells us about the kidneys, this other group checks on the liver, and another one looks at electrolytes and blood sugar. It makes the whole thing so much less intimidating.
So for example, let's just grab one group, kidney health. You've got BUN and creatinine. Both of these are basically waste products that your kidneys are supposed to be filtering out of your blood. So if your doctor sees both of these numbers creeping up together, it's just a little clue that says, hey, maybe we should take a closer look at the kidneys. It's the same logic for all the other groups.
Okay, we've decoded the tests, we've learned the system, but now we get to what is, honestly, the single most important piece of advice to remember when you're looking at your own results. If you take away just one thing, let it be this. A single lab test is just a snapshot. It's one picture, taken on one day at one particular moment. But your health is a movie. What your doctor really cares about are the trends over time. A single weird number could just be a blip, but the movie of your results over the years, that tells the real, meaningful story.
And Dr. Suzanne Salomon from Harvard Medical School just nails it here. It is so easy to see a number flagged in red and your mind just races to the worst-case scenario, but context is absolutely everything. You just have to resist that urge to jump to conclusions until you've actually talked it over.
And that context can be so many different things. I mean, just not drinking enough water before the test can make your kidney numbers look a little high. If you're getting over a cold, your white blood cell count might be up. Even being stressed out or which specific lab ran your test can cause tiny little changes. A lot of these things are temporary and they don't mean something big is wrong.
So here's the game plan. Next time you get that notification, don't panic. Open it up and review it using these ideas. Check the 3 pillars on the CBC. Group the CMP results by what they do. And if you can, pull up last year's results and see how they compare. That way, you walk into your appointment not with a head full of anxiety, but with good, smart questions ready to go.
At the end of the day, these lab results are just a map. They're a map of what's going on inside your body at one specific moment. They aren't the destination and they aren't the diagnosis. They just give you and your doctor the information you need to figure out the best road ahead, together. And now, you know how to read the map.